If someone tells you they just have a bad headache and fever, it sounds harmless, almost routine. But in emergency medicine, those two symptoms together can sometimes be the first quiet warning of something far more serious happening inside the body. Something that can escalate faster than most people realize. Meningitis. Now, I'm not saying this to create fear. I'm saying it because in my 13 years working in emergency medicine as Dr. Miles, I've seen a consistent pattern that most people miss. By the time meningitis becomes obvious, it is often already an emergency. And the difficult part is this. Early meningitis can look exactly like flu, stress, or even exhaustion. So in this video, I'm going to walk you through how to recognize it early, what symptoms matter most, and when you absolutely should not wait. And if you stay until the end, I'll explain the simple decision rule doctors use in emergency settings that helps us decide when to treat immediately without waiting for test results. What meningitis actually is, in simple terms. Meningitis is an inflammation of the protective layers surrounding the brain and spinal cord. Think of your brain being wrapped in a thin protective covering. When that covering becomes inflamed, usually due to infection, it can start affecting how the brain and nervous system function. Now, there are different types. Some are viral and less severe. Others are bacterial, and those are the ones doctors take extremely seriously because they can progress quickly if not treated early. The challenge is this. At the beginning, you cannot tell the difference just by symptoms alone. Not even in a hospital without tests. That's why awareness matters. Because timing is everything. Why meningitis can become dangerous so quickly. The human brain is extremely sensitive to inflammation and infection. When meningitis starts progressing, it doesn't always give long warning periods. Instead, what often happens is a gradual shift. Mild symptoms at first, then worsening discomfort, then sudden neurological changes. And this can happen over hours in some cases. The reason is simple. Once infection affects the protective layers around the brain, pressure, inflammation, and immune response can begin interfering with normal brain function. That's why doctors treat suspected cases urgently rather than waiting for certainty, because delay is the biggest risk factor. Early symptoms most people ignore. This is where most people get misled. Early meningitis often looks like a common illness. You might notice a headache that feels unusual or persistent, fever or chills, feeling unusually tired or washed out, body aches that feel stronger than normal flu. On their own, these symptoms don't look alarming. But the key detail is this. It feels different from your usual sickness. Patients often describe it as not like my normal flu or something feels off. Another early warning sign is sensitivity to light. Bright environments may suddenly feel uncomfortable. At this stage, many people stay at home, assuming rest will fix it. And sometimes, it might be something mild. But this is also the stage where early medical assessment matters most. Not because it's definitely meningitis, but because you don't want to miss it if it is. When symptoms start becoming more concerning, as the condition progresses, symptoms tend to intensify and become harder to ignore. This is where we start seeing clearer red flags. One of the most important is neck stiffness. Not just general soreness, but difficulty bending the neck forward comfortably. Another is a worsening headache that doesn't improve with rest or usual medication. You may also notice confusion or feeling mentally foggy, difficulty concentrating, unusual drowsiness, irritability, or unusual behavior. At this point, the pattern becomes more concerning because it is no longer just general illness symptoms. It is now involving the nervous system, and that changes urgency completely. This is the stage where medical evaluation should not be delayed. And if you are unsure, it is always safer to get checked. If you're finding this helpful so far, take a second and subscribe to the channel. It really helps me continue creating clear, practical medical explanations like this that can actually help people recognize serious conditions early. All right, let's continue. Emergency warning signs do not wait at this stage. There is a point where symptoms stop being watch and wait and become urgent. These include severe confusion or disorientation, difficulty staying awake or waking up, seizures, severe sensitivity to light and sound, rapidly worsening illness. At this stage, this is not something to monitor at home. This is when emergency care is required immediately, because at this point, the body is struggling to maintain normal brain function, and the priority becomes rapid medical treatment. Many people associate meningitis with a rash, But here's something most don't realize. Not all cases develop a rash, and when it does appear, it is often later in the illness. The rash may look like small red or purple spots that do not fade when pressed. But waiting for a rash before acting is dangerous because it is not an early warning sign. It is often a late sign, so the absence of a rash does not mean safety. Who is most at risk? Meningitis can affect anyone, but some groups are more vulnerable. Young children, teenagers and young adults in close living spaces, people with weakened immune systems, individuals recovering from infections. The reason young people are often mentioned is due to close contact environments like schools, dormitories, or shared housing. It spreads through respiratory droplets, which is why close living conditions increase risk. But again, anyone can be affected. So symptoms matter more than assumptions. What happens when you go to hospital? If meningitis is suspected, doctors do not wait. The first step is usually blood tests and clinical assessment. If concern remains high, treatment often begins immediately. Because in suspected bacterial cases, time is critical. Additional tests may include blood cultures, imaging, and sometimes a spinal fluid test to confirm diagnosis. But importantly, treatment is often started before confirmation if risk is high enough. This is because early intervention significantly improves outcomes. The key decision rule doctors use, here is something simple but powerful. If a patient has a combination of severe headache, fever, neck stiffness, confusion, or drowsiness, we treat it as an emergency until proven otherwise. This is not because every case is meningitis, but because missing it has serious consequences. So doctors act early, then confirm later. That principle saves lives. What you should do if you notice symptoms, if symptoms are mild but concerning, seek medical advice the same day. Contact a doctor or urgent care. If symptoms include confusion, severe headache, or neck stiffness, go to emergency care immediately. If someone is very drowsy, confused, or difficult to wake, call emergency services without delay. And if you are unsure, it is always safer to get checked. Simple prevention awareness. While not all cases can be prevented, some steps help reduce risk. Staying up to date with vaccines where available, avoiding sharing drinks or close exposure when sick, paying attention to unusual symptoms after infections, not ignoring sudden severe illness. But the most important protection is awareness, because early recognition changes everything. Meningitis is not always common, but when it happens, it can progress quickly. The early symptoms often look harmless. That is what makes it dangerous. But the goal of this video is not fear, it is awareness. Because when people recognize the early warning signs, they act sooner. And acting sooner makes the biggest difference in outcomes. So remember this simple idea. If something feels wrong, different, or rapidly worsening, don't ignore it. Get it checked. If you found this helpful, consider subscribing to the channel. It helps me continue breaking down important health topics in a clear and practical way. And if you think someone around you might not recognize these signs, share this video with them. It might help them act early, and that can make all the difference. Thanks for listening. I'll see you in the next one.